So now we're going to take a look at the Criterion's patient portal. Now this patient portal is something that comes with the Criterion's EHR. It's not a third-party application. It is built right into the system. So it's not something that requires extra interfaces, and you don't even require a domain or your own website. This can be your website should you choose to. Otherwise, you can put a link to this on your website. When a patient comes in, you can direct them to the patient portal once you've captured some of their information so that the patient can log on and begin completing information for the physician and for the practice. Once the patient's registered, they can log into the patient portal and it will walk them through a series of questions based on what the practice has configured. Now, all of this is customizable as far as what you want to show the patient, what options you want them to have, but this can ask them to confirm things like their demographics, insurance information. But where it really becomes effective is that you can start capturing patient histories. So things like past medical history, social history, family history. The system can populate a list of commonly selected items the patient can go through, select something that then gets added directly into their account within the EHR. Now, this will also do what we refer to as alias text, where if you want to ask the patient whether or not they have syncope, the system can translate that into fainting so that the patient understands the term, while it will show in their record in the EHR as syncope. As I was saying, this can do things like medical history, this can do family histories, surgical histories, social histories. All of these different items can be captured. All of the values are customizable. So as a patient walks through, whatever lists you want to present to them can be adjusted. Social history can ask the patient a number of questions with responses based on, or with options based on the patient's response. This will also allow a patient to add a list of medications. So while the patient is at home and has their prescription bottles in front of them, they can go through and enter the information accurately. Instead of coming in and not being quite sure what the medication is, they can do a medication search and add the actual medications and dosages directly into the system. The same will work for allergies as well. Now, this becomes effective in other ways where this will allow a patient to find their pharmacy. So a patient, instead of the physician or the practice trying to determine which pharmacy the patient uses, they can add those pharmacies directly through the patient portal. Patients can also view things like test results. So once a doctor has signed off on results, they can present these to the patient through the portal so that they have access to that information. They can print them out and have them for their own records. Patients can also receive clinical summaries. So if you want a patient to be able to see a summary of a particular visit at the practice, they can use the patient portal and you can configure what information from that visit you want to present to the patient. Preventative care suggestions. If a patient is due for a particular test or procedure, the system can notify the patient of particular items that they are due for. Procedure summaries. If a procedure is completed and you want a patient to have a printout or a document showing the information that was entered, that as well can be presented to the patient here. Again, all of these options are customizable where you can choose to show as much or as little of this information to the patient. Further, you can go through and actually allow patients to create their own appointments. This is something that some practices choose to do. You do not have to, but this allows a patient to go through, select the reason they're coming in, the doctor they're going to see, the location they're coming to, and the system will give them a few choices as far as appointment times that they can book. And there are many rules you can configure for the patient saying if they've already got an appointment, don't allow them to book additional appointments. You can set up different schedules to allow booking of through the patient portal on specific days or times. So you could say, I only want to allow patients to book follow-ups on Fridays between 1 and 4. You can set a number of different rules that will apply to the specific patient. You can also have patients go through and complete uh, forms and other documents. There's a number of different configuration usages, but this comes with the Criterion EHR and it is built directly into the system.